Hello, everyone. Thank you for joining today's webinar. And we're still waiting for colleagues to join us. We will be starting shortly. So please wait a bit. Good afternoon, good morning, and good evening, everyone. We welcome you all, particularly those of you joining from far away or at late or at very early times. We already see around 350 colleagues joining us in today's webinar. So thank you for joining this WHO EPI-WIN webinar, Stronger Together, Strengthening One Health Multisectoral Collaboration through the National Bridging Workshop program. And I know many of you have been attending EPI-WIN, but for those of you who are new, EPI-WIN is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. And our goal is to translate technical scientific knowledge into something that is accessible, understandable, and relevant for evidence-informed actions and decisions, especially in countries. And this is for health emergency preparedness and response. Today, we have a great panel of experts to discuss the National Bridging Workshop for One Health Multisectoral Collaboration. My name is Lester, and I will be hosting today's webinar. I'll give you a quick overview, and you can see in the screen the names of the speakers, of our excellent speakers today. And then after this, there will be our presentation is prepared well by the team, so it will run as a PowerPoint video presentation. So we will hear first from Dr. Stella Chungong, our director from Department of Health Emergency Preparedness in WHO Geneva. She will be giving opening remarks. And then we will hear from Ong Orn, or AIM, Prasan Panish, a technical officer also for One Health in WHO Geneva. She will give us a brief introduction of the topics. And during the actual presentations, she will be introducing the technical sessions. We will hear from Dr. Stepan de la Roque, the unit head for country assessment, planning, and readiness in WHO Geneva. He will introduce to us the IHR PVS National Bridging Workshop Program. And actually, this National Bridging Workshop has been conducted in many countries already. So the next part is a review of the NBW roadmap analysis and results, and this will be given by Dr. Carmen Alfonso Dile, our consultant. And then we will be hearing country experiences from Cambodia, Ethiopia, Tunisia, Ukraine, and Uganda on how they implemented this National Bridging Workshop for One Health multisectoral collaboration. So from Cambodia, we will have Dr. Vanderith Nov. From Ethiopia, we have Dr. Mohammed Ibrahim Abdikadir. From Tunisia, Dr. Kauthar Okaili. From Ukraine, Dr. Olena Kuryata, and they're all with WHO offices, I believe, and they are the NBW catalysts. From Uganda, we will also hear from Dr. Alice Nematovu, who is from FAO, Food and Agriculture Organization. And then we will have a Q&A session, which will be led by AIM, our colleague. So that will be our great speaker, the speakers we will be hearing for today. Before we proceed, here are some housekeeping and reminders, and I think most of you are already familiar. This webinar is being live streamed on the EPI-WIN YouTube channel. We are also recording this webinar, and after that, we will be sharing this recording from our website. We will share the links with you. We invite you all to post your name, location, and organization in the chat box. And I think we have already seen many colleagues, more than 400, going 500 colleagues who have joined us. We also have interpretation to French, so just check the lower part of your Zoom screen for the interpretation if you need it. I'm sure you have questions, so please use the Q&A box. We will be monitoring the questions, and our colleagues hopefully can also answer some of these. So please put your questions in the Q&A box and not in the chat box. Keep all your comments relevant to the topic and positive. Avoid negative, rude, or disruptive comments. Otherwise, we will remove you from this webinar. So those are just some of the few reminders for the webinar, and we are looking forward really to what we will learn today in this webinar. Without further ado, I turn over to Dr. Stella for the opening remarks, and then after that, we will run the presentations and the lectures. So Dr. Stella, over to you.
Thank you so much for the overview and the introduction. So, and good morning, good afternoon, good evening to all online, and welcome to this EPI-WIN session. We are here today to explore a critical topic in health emergency preparedness, the One Health approach, and how it is being operationalized through the National Bridging Workshop Program. The majority of epidemics and emerging infectious diseases are zoonotic in nature, which means originating from animals and affecting humans. This reality underscores the urgent need for a One Health approach, which promotes collaboration across human, animal, and the environmental health sectors. One Health is a collaborative, multisectoral, and transdisciplinary approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. The World Health Organization, in partnership with the Food and Agricultural Organization of the United Nations, FAO, as well as the World Organization for Animal Health, WOHA, and the United Nations Environmental Programme, UNEP, collectively known as the Quadripartite, supports countries in strengthening their multisectoral collaboration for health emergency preparedness. The National Bridging Workshop Program is a joint initiative to improve collaboration across human health, animal health, and the environmental sectors, not just at the national levels, but also at the subnational levels and at the local levels. The NBWs, as they are known, bridge two fundamental frameworks: the International Health Regulations and the Performance of Veterinary Services pathway, which help countries to align the global instruments across these two areas of work. The NBW approach includes a 3-day workshop to assess collaboration and develop a joint roadmap, a follow-up process to monitor and support implementation, and a network of NBW catalysts, and you'll be hearing from some of them today, who are in-country One Health experts and who facilitate progress and coordination. The resulting NBW roadmap is a realistic, actionable plan jointly developed by all sectors. It can be integrated into the National Action Plans for Health Security, which is known as the NAPS, ensuring alignment with the international health regulations, with the joint external evaluations, and with the states parties' annual reports, known as the SPAR. To date, over 60 countries have conducted NBWs, and 20 NBW catalysts are actively supporting implementation. The impact has been overwhelmingly positive, as you'll hear later today. 99.7% of participants recommend an NBW to other countries. Another 98.4% report improved multisectoral coordination following this process. In today's session, you'll hear about the 3 core elements of the NBW program, the workshop, the follow-up, as well as the NBW catalyst. Insights from the analysis of over 50 NBW workshops and roadmaps developed in more than 50 countries will be discussed, as well as concrete examples of NBW implementation and the growing community of practice. We hope you'll find this session informative and inspiring, and thank you for joining us today. Back to you, Chair.
Thank you so much, Dr. Stella. Thanks for giving us an introduction and background of the National Bridging Workshop and also the partners working together for One Health. We will not be doing Slido today, but we would still love you to participate. There will be many new presentations and experiences from countries, so feel free to post questions in the Q&A box. And now we proceed with the presentation and requesting the IT support to share the slides and the videos. Let's wait a bit. All right.
Good morning, good afternoon, good evening, everyone. Thank you very much for joining us from around the world for today's session on strengthening One Health through the National Bridging Workshop or NBW program. I'm Ong Prasan Parnich from WHO headquarters. I'll be taking you through different speakers and presentations that we have for you today. First, you will hear from Dr. Stéphane de la Roque on the overview of the IHR, International Health Regulations, and PVS, or Performance of Veterinary Services, National Bridging Workshop Program. It's more than just a workshop, and you will hear more about that. Next, you will hear about the analysis of 51 roadmaps resulting from more than 50 workshops around the world, and this will be from Dr. Carmen. Next, you will hear about the actual in-country experiences and impact following the NBW programs and communities of practice. So first, I'll give the floor to you, Dr. Stéphane, please. Good morning.
Thank you very much. The idea of the bridging workshops comes from the field, from the experience we had in the management of different zoonotic diseases. During such events, it's very important that the different sectors are appropriately coordinated so that they can align their activity and go together in the same direction. This picture, for example, is from an outbreak of Rift Valley fever in a country. The Rift Valley fever is a disease where the virus usually amplifies in animals before affecting humans. And here on the picture, you see the Ministry of Health, the Minister of Agriculture, together during a press conference. But the problem is one of them is saying that the animal are dangerous and the meat and the milk should not be eaten, while the other said exactly the opposite. So at the end, it created a lot of confusion. And this could have been avoided if a better coordination before could have been established. How it's not so easy to discuss this coordination, even when there is a shared objective. It's really important to find a framework, a platform, an initiative that can bring the different parties around the same discussion that need to be structured. And a few years ago, we realized that international health regulation could serve as such a framework. So I don't know how familiar you are with the IHR, but there is an important article, Article 5, which states that all countries should develop the capacity to detect, assess, notify, or report events of potential public health concern. And this can be used as a common objective for the different sectors working through a wall of government approach to build this capacity. So practically, we have some tools that help to assess the capacity in the context of the IHR through what we call the IHR monitoring and evaluation framework. You may know some of them, the joint external evaluation, for example. And then in the veterinary sector, we have another tool developed by the World Organization for Animal Health. The name is PVS, Performance of Veterinary Services. So the idea is to see how these two approaches, these two tools can discuss together so that the different assessment can be reviewed jointly. So that was the idea behind the national bridging workshops. And just to see how it looks like, we will use a video of a bridging workshop recently conducted in Mongolia. So the national bridging workshop start with an opening with national authority from the different sectors, and very rapidly participants are grouped in exercise where in fact you have representatives from the different sectors, from the different levels in the country, and the participants are asked to discuss about their level of coordination for different diseases using cards, depending on, of course, some key function like, surveillance, risk assessment, laboratory, and then they are requested to evaluate their level of capability in terms of coordination for a different disease. And then we use indicators of the PVS and the GE on a big matrix like that, where the cards are positioned. And it's interesting because we start to see that it's not only, you have some cluster of red, of yellow, so it's not only a problem of one disease, it's a problem that is a little more generic. And then we continue the workshop, focusing a little more on some of this technical area, where we will try to elaborate a little more on how we can improve, what action needs to be done to improve this coordination. So another exercise with other working groups, different people, different sectors. So discussing a little more on what could be the activity to improve this coordination. And this activity will then be grouped in a roadmap. This roadmap will be prioritized. So we will use the IHR monitoring and evaluation framework. We use PVS also to review the assessment done by experts, just to be sure that we understand perfectly the problem and that we can propose something that is very operational, consensual, and can be further included in the National Action Plan for Health Security, for example. So this is the objective of a bridging, to develop this roadmap for One Health that is incredibly powerful. As of today, 66 countries have conducted a workshop. So the implementation of the roadmaps are regularly monitored. And in fact, in a few minutes, we will have Carmen, who will explain to us the analysis that has been done in terms of implementation of these roadmaps in a significant number of countries. But before giving her the floor, allow me to say a few words about the network of national experts that we call catalysts to continue to promote the implementation of the NBW roadmap in their respective countries. You will have the opportunity to hear from some of them the sort of activity that are conducted and the achievement and the result that they get in countries. The catalysts form a community of practice that is very, very active and exchange regularly through a program that we coordinate jointly with our colleagues from all the regional offices in FAO, in WOHA, and in WHO. And this is really a very successful program. So allow me to take this opportunity to express my very sincere thanks to all who are involved in this program for their continuous engagement and support, and also to the audience today for your interest in this initiative. And I don't want to spend more time on this. Let's go immediately in countries after Carmen explaining to us the analysis of all these roadmaps. Thank you very much, Anne.
So my name is Carmen Alfonso Dilly. Thank you very much, Stefan, for your introduction. And now that everyone, sorry, can we go back to the previous slide so that I can just start again? Thank you. So I'll present to you the analysis of the National Bridging Workshop documents, roadmaps that we performed in March of 2024. as I wait for the next slide to come on, we have done national bridging workshops in over 66 countries now. And at the time of the analysis, we had 51 roadmaps that had been verified and approved by national stakeholders and could be included in the analysis. So we performed a document analysis, reading the roadmaps to identify patterns in the data and information recorded within them. And we used an inductive and deductive approach, hybrid approach, generating codes from the roadmaps themselves. And also using the tripartite zoonosis guide, which is the zoonotic disease management framework document for zoonotic disease management. And we turned that into a code book where we had the description, the code description, inclusion and exclusion criteria, which allowed us a methodology that was flexible enough to capture the diverse and emerging information from the roadmaps themselves, while being anchored to the rigor of an established global framework for zoonotic disease management. We attributed the codes to each roadmap activity when the contents would meet the description and exclusion and inclusion criteria. So for example, here we have an extract from Bhutan's roadmap. So the first activity is to develop joint risk communication messages. So it was attributed to code 29. And then the other two activities were attributed to code 30 to develop platforms for risk communication and community engagement. Forgive me, I'm doing this on the fly, so I do hope that you are hearing me okay and that it is working with the slides. Next slide should be coming up. Right, so first, to go with our descriptive results, we organized the 60 codes that came out of our analysis into 6 themes. So strategic planning, joint operational procedures, technical coordination and governance, enabling environment, technical knowledge and capacity building, and testing capacity. And then we organized them by frequency, counted once per roadmap. So here you can see the top 15 activities, and you can go to the full article to see the rest. So the top #1 activity was to conduct simulation exercises, which was tied for first place in including as well as to develop electronic data and information sharing platforms between sectors. And #3 was to develop guidelines and SOPs for joint investigation and response, so standard operating procedures. So after we had all of the frequencies, we were able to perform statistical analyses, starting with hierarchical clustering analysis by activity, which showed a clear absence of clustering with no tendency for certain activities to appear together in the same roadmap, followed by a principal component analysis, where the first principal component only captured 7% of the observed variance, indicating that there was no single combination of variables that strongly dominated the data structure and variability. The hierarchical clustering analysis by country showed varying levels of statistical significance across different clustering methods and cluster numbers. So there didn't seem to be a clear regional clustering pattern, which was reinforced by the Jacquard similarity score between roadmaps, showing an almost identical similarity between roadmaps within the same region and between different regions, that 1/3 of roadmap activities are shared between countries regardless of their geographic proximity, again highlighting that there are no clear regional clustering patterns between the same region. So the statistical analyses show the lack of clustering in the hierarchical clustering analysis, the low explained variance in the principal component analysis, and comparable Jacquard scores show that the roadmaps are tailored to each national context, with countries developing a unique set of activities to meet their One Health needs. And again, that there's no, the geographic proximity does not seem to influence the types of activities that countries want to implement. Despite this, there is a interesting contradiction, is that only 2.2% of all country pairs had a roadmap similarity score of 0.5, but these pairs collectively involve 31 countries, showing that a significant proportion of countries share at least 50% of their roadmap activities with at least one other country. And this overlap between countries creates an opportunity for collaboration, resource sharing, and learning from each other's experiences, which is something that is actively encouraged in the NBW Catalyst program. And you can read more about their experiences in this report, and you will hear from them later on in this webinar. I'm waiting for the next slide. Right, so what does this all mean? That roadmap activities seem to primarily reflect a country's individual stage of One Health implementation, and there's an absence of a one-size-fits-all approach when implementing the One Health concept, and that the approach needs to be tailored to each country's context. The National Bridging Workshop methodology, which was designed to help countries tailor One Health activities to their specific needs and capacities, supports this needed flexibility as countries move forward with their One Health approach. So our descriptive results reveal priority areas for One Health collaboration identified by countries themselves, which can help international organizations to streamline how they support countries in building their One Health capacity in order to strengthen global health security against zoonoses at the human-animal environment interface. And all of this using a country-led approach. So thank you very much for your attention, and I will pass over to my colleague now.
Thank you, Stefan. Thank you, Carmen, for providing an overview of what the program is, as well as the analysis of the results from 51 countries. And thank you, Carmen, for compiling the resources for NBW on the screen. We will also share the links in the chat so you can have a look at them. Next, you will hear about the applications of the NBW in countries from the One Health champions, and we will start with Ukraine and Cambodia. The floor is yours, Olena.
I don't think we can hear. If you can start from the scratch, and we will, in case if there is a need, I can do the same as Carmen.
Yes, Olena, I think it's best if you can also speak
sure.
from your end.
Yeah, sure, no problem. I understand all the technical issues. So once again, good afternoon, all the colleagues, and it's my real big pleasure to be here representing Ukraine as a One Health catalyst, showing some experiences and share how NBW influenced in One Health capacitation in Ukraine. And can I have the next slide? Thanks. So back in 2024, Ukraine conducted the National Bridging Workshop despite the challenges like COVID and a full-scale invasion. So it was really a critical step in enhancing the implementation and application of the One Health approach. And that's how our journey began, by understanding our weaknesses. So the NBW provided like a crucial outcome, the diagnosis of the gaps that we need to address, and the One Health roadmap. Next slide. So, so we didn't just identify gaps, but we use this One Health roadmap to act. So let's say our work on rabies shows how we transformed these challenges into coordinated actions. For instance, work on the development of the National Rabies Elimination Strategy and its operational plan. And this work has been performed by utilizing the One Health reach across the sectors and also different partners involved. And like another big deal was also to initiate the cross-sectoral ad hoc group to maintain the One Health communication tools for rabies prevention, such as posters, social media tiles, video carton for children, brochure for children. And all of these were used also by sectors to promote communication campaign. Next slide. While we are, yeah, great. The roadmap is not like we call it, not a one-time fix. So we have been using its lessons really proactively. And another prioritized zoonotic disease for Ukraine is avian influenza. And we used the lessons learned from the NBW. So we designed from the scratch a cross-sectoral tabletop exercise, like a simulation exercise, to test and strengthen the response capacity of national stakeholders working on the ground and also at the central level. So before, let's say, the potential pandemic hits, so also with the special focus to communication component, like RCC component. And it was also one of the gaps identified by experts during the National Bridging Workshop. So our next steps will be to develop concrete SOP on joint coordination and joint risk communication between the sectors. Yeah, so our work, next slide, please. Our work is not done in isolation, and the Catalyst community, I would really want to name it Catalyst family, provides invaluable support, tools, and connections. So this synergy has elevated efforts embedding One Health principles into our day-to-day work. The quarterly meetings we have of NBW Catalysts, they really serve a great platform for sharing our deliverables, but also to discuss our pains and issues. And here I feel that I'm not alone, building bridges between the sectors. Another really great component to highlight here is that National Bridging Workshop community helps to enhance and to maintain a huge network of contacts also within the quadripartite organizations. Thus, a lot of Ukrainian initiatives related to One Health are supported by colleagues from FAO, WOA, and UNEP. For instance, the upcoming Monday, we will hold a webinar related to One Health Day on November 3rd. We will navigate together the climate change and vector-borne diseases with the support of colleagues from the quadripartite organizations. Next slide, please. Yeah, so NBW outputs were embedded into Ukrainian NAPS, National Action Plan for Health Security, which is like a live document for Ukraine, and also helped to set the basis for the pandemic fund proposal this year, ensuring alignment between the national priorities and also international financing opportunities. And coming to the conclusions and key takeaways, just to make sure that it is highlighted that National Bridging Workshop Roadmap is like a dynamic tool for countries that turns identified weaknesses into concrete strategic actions, and that with the Catalyst support, we have crucial support for driving implementation and translation of One Health into action. And with this Catalyst community, it is really essential multiplier, and it helps us to foster global support. And with this, yeah, I thank you for attention, and really happy to share our experience.
Thank you so much to our colleague Olena from Ukraine. We are now proceeding to the experience from Cambodia. Let's see if the sound is okay. Otherwise, we will request the speaker to also speak. Can we play the PowerPoint? Or maybe I can use mine.
Lester, perhaps you could try sharing to see if the
Okay.
sound is better.
Right, thank you. So we would like to request if, okay, I can share from my end. And we apologize for this difficulty, technical difficulty that led me to that.
An NBW catalyst from WHO Cambodia. Today, I
hope you
have a
can hear.
great honor in order to share my experience on the NBW implementation in Cambodia. And I am excited to be part of this session and looking forward to learning and sharing with all of you. This is the One Health governance structure in Cambodia. The IMCC One Health is the one who leads the multisectoral collaboration mechanism. And after that, we have the IMCC One Health Secretariat that serves as a central unit for coordination as well. And the NBW Catalyst work very closely with IMCC One Health Secretariat in order to provide the technical support to each thematic area and also to implement One Health Action Plan as well, and to make sure that the activity that we have prioritized made the progress. We also have the subnational multi-sectoral mechanism, which are integrated in existing coordination system, which are by provincial governor. So this is how One Health Cambodia look like and how we work together in order to make sure that everything are going well and the activity plan are implemented. Actually, for this slide, I would like to show you how NBW roadmap contribute to action. After the National Preaching Workshop was organized, there are 6 action tracks of NBW were identified, including communication, coordination, laboratory and surveillance, education and training, emergency response and field investigation, finance, legislation, and human resources. Under the 6th action track of NBW, there are 11 objectives and 38 activities. Among the 38 activities, it has been prioritized and make some progress for NBW in Cambodia. Actually, the prioritized activity that we have been done, including the development of National One Health Strategy, the multi-sectoral zoonotic disease strategic plan, the National Action Plan for Health Security, the National Strategy and Action Plan for Food Safety, the Cambodia Respiratory Pathogen Pandemic Response Plan, and multi-sectoral action plan for AMR that has been reviewed and revised to the second edition. Actually, this is just the prioritized activities, but the remaining activity we also take it to include in its strategic and policy for the direct implementation by each thematic area. Actually, for this activity of NBW require a multi-sectoral coordination mechanism that is supported by a secretariat, relevant technical working group, and adequate funds to function effectively and sustainably. This is an example of effective engagement and response when there is any happen like a pandemic or outbreak in Cambodia. After the COVID-19 pandemic and also the National Preaching Workshop happened, the multi-sectoral zoonotic disease strategic plan had been recommended to be developed. Under the strategic plan, there are many activities that we have to do in order to build our communication, our coordination, and other capacity building, including surveillance laboratory, and so on. So in this slide, I just raise up some document that we have to do and what we have been done in order to support our country when there is any even happen unpredictable, it including the Cambodia Respiratory Response Plan and One Hair Rapid Response Team. So in order to make this happen, NBW Catalyst is very important to coordinate with the team in order to make all of these things happen and successfully develop. Not just only this, for example, like in Cambodia, when there is any other pandemic or any other outbreak like like H5N1 case outbreak in Cambodia, like in 2024, 2025, the NBW actually also have a key role in order to provide the technical support to the team as well. Actually, according to my experience, I am not the one who go to the field directly to support the outbreak investigation or respond, but I am work on another side to support, like develop the protocol, collect the information to update to the team and also the counterpart, and also provide technical guidance, and sometimes we provide some training to the staff who will go to the field and so on. And sometimes we provide like the translation to the document, and also like provide support on develop the reassessment tool and also the recommunication tool. Yeah, there are many things that we can support, but it is flexible and depend on the situation of your country and my country. So this is what NBW Catalyst can be do right now to support all of these things. Thank you for your attention, and that's all for my slide presentation. Thank you so much.
Thank you, Olena. Thank you, Nov, for sharing the experiences from Ukraine and Cambodia. We really hope to get different examples from other regions as well. So next, you will hear from Uganda, Ethiopia, and Tunisia. Alice, the floor is yours.
Alice Namatofu, the National Bridging Workshop Catalyst for Uganda, and also working as One Health and Livestock System Expert with FAO Uganda. So I'm happy to share the National Bridging Workshop experience for Uganda. Uganda first had its National Bridging Workshop in 2017, and it yielded a roadmap of 12 objectives and 35 activities. And we did a follow-up survey of in 2022, February, which yielded 13 roadmap of 13 objectives and 39 activities. Yeah, with regards to sharing experience on how the roadmap, National Bridging Workshop has impacted with regards to the real outbreaks or emergency. For Uganda, I'll share an outbreak investigation of anthrax, which occurred between January and March 2025. Normally, because of our communities wanting where people want to eat meat, in case we get outbreaks in animals, the district veterinary officer may not get that information in time. But normally, information is got from the district health officer when the slaughterers or people who deal with that, the butchers are affected with cutaneous lesions. So from there, when people have the cutaneous lesions and they moved to health centers, the health centers. Information will move to the district health officer, who will contact the district veterinary officer, and then both the district veterinary officer and the district health officer will report to their line ministries, that is Ministry of Health and Ministry of Agriculture, Animal Industries and Fisheries, respectively, in case of an outbreak. So with the National Bridging Workshop, that promoted collaboration between people, between Ministry of Health officials and also the veterinary side, and with the spirit of One Health. Normally, an investigation team is constituted and it's multisectoral, involving people of different background and discipline. So there, when they go to the district, for example, that was in the Zimbabwe, they normally hold an entry meeting where they meet the different officials, the district health officer, the district production or district veterinary officers. And this time in Zimbabwe, we're able to, because it was first noticed in humans, then the district task force was active, and they would have regular task force meetings, and these meetings have members of the district One Health teams. So we're able to join the meetings here, the steps they've taken to try to contain the disease. So from there, we had to go to the field to do outbreak further investigations in the field, and we were able to land on a cow that had died suddenly. So from there, we were able to pick samples from the soil where the animal had died, and we were able to advise, the farmer with the next step, and that was burying. We actually left an officer who supervised burying of that animal. So in the next photo, we are seeing where our team also participated in digging, because most times the farmers don't want to incur losses. They want to sell off the dead carcass. So the dead animal, at least to recover some little money. So we participated in the digging and also the burial of the dead animal. So during our investigation, we also moved on and found that there was another animal that had died suddenly, but slaughterers had opened it, and they had actually, when they noticed that we were coming, they were able to take off some of the carcass. Part of the carcass was taken, but we still were able to support the burial of the remaining, and also ensuring that the area is decontaminated. So samples were taken, and were able to do microscopy in the district lab, but also referred samples to regional labs and national labs for confirmation. So in that exercise, as we moved with the district veterinary, with the officers from MAIF, when they had of those other previous outbreaks, they were able to procure some vaccines. So in our team, we were able to move with vaccines to allow vaccination of animals around the affected areas. And from that, after the investigation, we had to attend to have an exit meeting with the District One Health task team or task force, and we had to agree on the measures that have to be done to ensure that the disease is contained. Yeah, with that, I would like to thank the government of Uganda, particularly the National One Health platform, with which we've been working a lot tirelessly to ensure that we promote One Health and do joint outbreak investigations. I would like to thank Food and Agriculture Organization for having sustained this catalyst position, and like to thank all the listeners, WHO. Thank you so much for the opportunity. Thank you.
Good morning, good afternoon, good evening, depends on where you are. My name is Mohammed Ibrahim. I am NBW Catalyst from Ethiopia. My presentation will highlight the One Health history in Ethiopia and the contribution of the NBW Catalyst and final conclusion. So when it comes to the history, Ethiopia has conducted a joint external evaluation in 2016, in which one of the recommendations was to establish One Health platform, and the country has succeeded to establish National One Health Steering Committee in 2017, with MOU signed among key One Health ministries. But as of 9th February 2023, Ethiopian Public Health Institute has been mandated to coordinate all One Health initiatives or activities in the country. The country has conducted NBW in 2018, but until 2021, there was not any feedback or information regarding the roadmap activities. Therefore, based on the template provided by the tripartite, the country has conducted the NBW survey conducted. 53% of those activities are partially conducted, and also 40% has not yet been implemented, whereas the main reasons were due to financial and the technical support limitation. You can see in the table how, starting from December 2022 until October, increased the implementation after the NBW Catalyst. Regarding the question of how the implementation of the NBW roadmap support as a catalyst for significant impact on outbreak or emergence, I can mention a lot, but very few to say that the development of One Health strategic documents, resource mobilization, to mention the World Bank Fund, that is the pandemic fund, where more than about 60 million USD has been mobilized. Partnership, One Health RRT, strengthening the subnational One Health task force capacities, improving One Health cross-border coordination. You can see in the picture, it's not only within the country, but also after the One Health simulation exercise among Ethiopia, Kenya, and Somalia. We also have concluded and achieved to get high-level One Health policy signed among the three countries, as you can see in the picture. Regarding the One Health or the catalyst community of practice, how it helped as a personal, as also as a country to implement One Health activities. It actually improved my personal knowledge, experience sharing of other countries, which helped me to speed up the One Health activities, and also the publicity at the global platforms. That means we have physical NBW reunion every. Finally, how does the NBW roadmap develop countries' capacity to better respond to concrete outbreak or health challenge? It helped actually to establish joint human and animal task force for better zoonotic disease management, resulted establishment and capacitating regional One Health platforms, enhanced the human-animal lab network or collaboration, and also led to the establishment of National One Health Secretariat as of 2023 that I have mentioned. So as a conclusion, NBW Catalyst is instrumental for speeding up countries' NBW roadmap implementation and improve the capacity for prevention, detection, and response to zoonosis, food safety, and AMR through One Health approach. Thank you for your attention.
Good morning, everyone. My name is Kauthar Al-Khaili, Emergency Officer and NBW Catalyst for Tunisia.
It's a pleasure to share with you today how Tunisia has advanced the One Health approach through the implementation of the NBW roadmap and the close collaboration between the different stakeholders. So over the past few years, Tunisia has made remarkable progress in advancing the One Health approach, transforming it from the concept to concrete actions at national and regional level. Following the NBW workshop held in Tunisia in December 2023, a national One Health roadmap was developed. This roadmap, together with the National Action Plan for Health Security, served as the foundation of the definition of the Tunisia priorities to be developed under the Pandemic Fund proposal. The Pandemic Fund now is supporting Tunisian efforts to prepare for, prevent, and respond effectively to health emergencies through One Health approach. The direct beneficiaries of this project are the Ministry of Health, the Ministry of Agriculture, and the other ministries involved in the One Health approach, and also the civil society. The project focuses on 3 key components: the surveillance, the laboratories, and the health workforce. So, a strong advocacy for One Health has significantly increased visibility and political commitment to this approach. The Minister of Health took the lead in the implementation of the One Health approach in close collaboration with the Minister of Agriculture and the Minister of Environment. And Tunisia hosted the One Health MENA conference in June 2025. This conference culminated to the declaration of the Carthage Agreement. This agreement is a regional commitment to implement the One Health approach. The key commitments of this agreement are the integration of the One Health in the national policies, the investment in One Health system, the creation of the One Health Center, and the launch of the One Health community of practice. What can I present as a concrete example of the One Health implementation and the One Health engagement and commitment? As a concrete example, the rabies outbreak in 2024 is a good example to show how multisectorial collaboration and joint action could change and could have an impact. So rabies is an endemic disease in Tunisia, but in 2024, an unusual resurgence with 10 human deaths was registered. So the establishment, the National One Health Network, which existed before, but was strengthened through the NBW efforts and activities, was rapidly mobilized with implementation of joint actions like community engagement, training of health workers and animal health workers, awareness campaigns, animal and human health vaccination, and the results were remarkable. Only 2 human deaths were reported this year. So a strong One Health commitment and multisectorial coordination show the impact. What is the next and what is the future? The Ministries of Health and Agriculture are now collaborating to develop an integrated One Health disease surveillance system with the support of international organizations, the WHO, the FAO, and the World Bank under the Pandemic Fund project. The increased visibility of the One Health in Tunisia also attracted donor engagement. So I could talk about the example of the World Bank assessment on One Health system conducted in Tunisia. Finally, an important milestone was achieved with the launch of the joint postgraduate certificate in One Health It was inaugurated the last week. This program is co-led by the National School of Veterinary Medicine and the Faculty of Medicine of Tunis, making a major step for the implementation of the One Health through the education. Finally, in recognition of the Tunisian efforts, the Minister of Health of Tunisia received the One Health Award for his outstanding leadership and commitment to the implementation of the One Health approach during Teramo One Health Award in October 2025. So finally, thank you, and keep efforts together for the implementation of the One Health and the joint work for a good preparedness, prevention, and response to health emergencies. Thank you.
All right, thank you so much, colleagues. And there we have heard there many different experiences from countries. The last one you heard is from Tunisia, and then we had Ethiopia, Uganda, Cambodia, and Ukraine. And we heard a lot of innovations, frameworks, policies. Most importantly, we heard a lot their experiences, field experiences, joint actions, and the many benefits and positive impacts of this One Health approach. I'm now calling on our colleague Aim or Ong Or, Prasanna Pitch, to lead the Q&A, and we see many questions there from the audience. Over to you, Aim.
Thank you, Lester, and thank you all of the speakers for being with us today. So we have a lot of questions that some have been answered through the chat there. And thank you, Carmen. Thank you all the speakers who have responded to those questions. So for those of you who ask whether your countries have implemented NBW, I put in the link in the chat. So you can go on the link and check whether your countries have already had NBW implemented. So I have potentially two questions about the inclusion of other aspects of One Health, for example, the environment and other topics, for example, AMR, climate change in NBW. So I'll give this to Dr. Stefan, and I think Mohammed, you would like to add on that topic as well. So please, Stefan and Mohammed.
Thank you. So yes, potentially it's feasible. Practically, maybe it's important to keep in mind why we developed these bridging workshops. The idea was to help the different parties to discuss together around a common topic. So here we are not talking about developing a global plan for One Health, for example. That's not the purpose of the bridging. The bridging is we have to find ways to improve the coordination between different sectors, and it has been developed in the context of zoonotic disease. So what is missing for the management of zoonotic diseases? How can we improve the collaboration between the veterinary sectors, the human health sectors, the environment? What can be done? So it's far from exhaustive. It's very context specific. It's really, that's why it's important that, and this is one of the key in the bridging workshop, that the country takes the lead in the discussion. We are just here to propose an approach, a methodology, creating a sort of environment where this discussion can happen, but then the country is really leading the process. So for the moment, it has been mainly focusing on zoonotic disease, and I would say more specifically epidemics and big outbreaks. We developed a version of the bridging workshop for rabies, which was useful, and we did that with the partners, with FAO and WOHA, to be sure that it can be included in the global strategy for the eradication of rabies, because we don't want to create something that is running in parallel. We had some discussion about AMR, because there is also a global program for the antimicrobial resistance. We have not been able to go very far there. And when it comes to the environment, I mean, why not? For example, if we think of some climate-related events that we can work on and have the appropriate people in the room, we can use the same sort of dynamic that we create with the bridging to facilitate the discussion and try just to open options for improvement of discussion between these sectors. Obviously, it needs to, or it's stronger when it's linked to some legal or regulatory frameworks like the IHR or the PBS. That was very important in the development of the approach, that we can refer to these legal or regulatory frameworks. So we have to identify something similar on the environmental side, and that has been something that was a little difficult until now when it comes to the work with UNEP, for example, because we don't have such a framework that we can easily compare with the PBS, for example. But why not? Why not? The most important is that we create the environment and we create a dynamic, and then the topic can change.
Okay, thank you, Stefan. Mohammed, would you like to add on that, please?
Well, thank you, Aim. And I think Stefan has already highlighted the major points when it comes to inclusion of climate change into the NBW or as a strategy. So it's a beginning, and in the future there may be a lot of improvement or adoption, and including all those who are relevant. But at the beginning, the main purpose was to bridge the two tools from the human health, the IHR, and also from the animal health, which is the BVS, Performance Veterinary Services. That was the tool, and in the future that there is a window of adoption of that's done. Inclusion of the climate change, we should have to differentiate from the NBW to that of the national strategies. For example, in the case of Ethiopia, we do have the National One Health Strategy Plan, where we included the climate change component very specifically, that we understand that the climate change threats are real, and in the strategies is included, but not in the NBW, which actually will have an open in the future for the improvement. Thank you, Aim. Back to you.
Thank you. I think we probably have time for one last question, and I'll keep it quick. So it goes to Carmen. So the question to you is, if you have one improvement or one thing that you would like to do better in the design of NBW following the analysis of this roadmap, so what would that be?
Yes, so thank you very much for this question, and it actually goes very well with what we just previously discussed, what Stefan and Mohammed have talked about, because historically, the biggest challenge to the methodology has been ensuring that the environment sector is actively involved, since the methodology is based on the IHR and the PVS. But since UNEP joined the One Health quadripartite in 2022, this has become a bit easier. And in fact, when the UNEP team is actually actively involved in the organization and the facilitation of the NBWs, we can see that the roadmap reflects more activities that address the upstream prevention of zoonotic disease and other environmental issues. So that's the biggest challenge, and we are working with our partners to resolve it. But I mean, in the spirit of this whole webinar, it's really when we work together that all the methodologies and all the activities come together, and we can work together to address these issues at a national level and by extension global scale. So thank you very much.
Thank you, Carmen. So now I give the floor back to the EPI-WIN team, and thank you for the opportunity to address those questions.
Thank you so much, Aim, and thanks, big thanks to our speakers and for answering the questions live, and also many questions have been answered in the Q&A box. The team also shared the different roadmaps from 51 countries, so feel free to check that out. Finally, we are at the end of our allotted time. Thank you so much to our speakers, to our panelists, to the EPI-WIN team, our country colleagues, of course, the One Health team, and our interpreter. It was a very fruitful discussion, and with many questions as well. A lot of participation from the audience there. So thank you so much. The recording of this webinar will be available at the EPI-WIN website. We will inform you for that, and we will also inform you once the other um, references are available. If you want to keep updated on future webinars, feel free to check our WHO EPI-WIN webinar website, and also our mailing list. Please subscribe. We are posting here the topic for the next webinar that will be on November 5, From Data to Action, Understanding How WHO's Global Surveillance on Coronaviruses Informs Response. So we hope you could register, and see you also on Wednesday. We also have upcoming topics in November and December, including genomics, outbreak toolkit, new guidelines for meningitis, cholera, and so on. And so we look forward to future webinars with you. And again, thank you so much. Thank you all. Goodbye. See you next time.
Thank you, everyone. Thank you, EPI-WIN team.
Thank you.
Thank you. Bye-bye.
Bye.
Huge thank you to everyone.
Thank you. Bye bye.
Take care, colleagues.
Thank you. Bye.
Bye. Thank you.
Okay, I'm ending the webinar now. Thank you. Thank you.